Hello and welcome to our special show, Health and Wellness, Save a Life. I'm Gargi Rawat. Now imagine that someone suddenly collapses in front of you after a cardiac arrest and you cannot do anything. A scenario that is getting very common. Even young adults are suffering from sudden cardiac arrest due to a sedentary and stressful lifestyle. Without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. CPR knowledge will equip you with the skill and confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time. And today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Prakash Kumar Hazra, Senior Consultant and Head of Department, AMRI Hospital, Kolkata, Dr. Rajesh Jha, Associate Consultant Cardiology, Artemis Heart Center, Ranchi, Jharkhand, and Dr. H.N. Rai, Interventional Cardiologist, Rajendra Institute of Medical Sciences, Ranchi. Thank you so much, doctors, for joining us on this program, on this very important issue as well. Dr. Rai, first to you. During cardiac arrest, what happens to a person? Just if you could explain to our viewers, what is cardiac arrest?
Right. Good afternoon. So cardiac arrest means that the heart is not contracting or is contracting ineffectively. So how does a layman recognize this? The person who suffers a cardiac arrest is unconscious or is having some epilepsy-like activity, moving a little bit, or unconscious. The pulse is not felt, the patient is pulseless, the BP is not recordable. This can happen because of the heart stopping to function suddenly, or the heart is beating so fast that there is no effective blood flow. So that is cardiac arrest.
All right, Dr. Jha, does the sudden cardiac arrest mostly affect the elderly and people who have heart disease?
Yeah, actually it's a partially right. Usually the cardiac arrest occurs in the patient or the person who are already having some cardiac disease. So in India, usually we have seen recently so many young people, they are suffering from the sudden cardiac arrest and there is some underlying cardiac disease. So most common cause of the sudden cardiac arrest in the younger age or in the older population is the coronary artery disease, that is the blockage to the artery of the heart. So that is, blood is not supplying properly during the exercise or something, and suddenly the patient will have sudden cardiac arrest either because of the heart has stopped working or due to the heart rate is very fast, and that is called ventricular arrhythmia. There are some other causes in the younger population also, that is congenital, that is the hypertrophic cardiomyopathy or maybe ventricular arrhythmia, that is the in layman word it is irregular heart rate. So irregular heartbeat or very fast heartbeat that can cause sudden cardiac arrest also. But in India, since the diabetes and the hypertension is very common among the younger population and in the more than 35-year age, so the most common cause of the sudden cardiac arrest is the myocardial infarction, or in layman word, it's a heart attack.
Now, Dr. Rai, is it true that people who do strenuous exercise are at more risk of having cardiac arrest?
You can say that people who have underlying cardiac disease and indulging in strenuous exercise are more likely to suffer cardiac arrest. A person who has a structurally and functionally normal heart, by that I mean that he does not have any blockage in the coronary artery, the heart is structurally normal and does not have any arrhythmia or substrate for irregular heart rate or heartbeat, that is arrhythmia, is unlikely to suffer sudden death during strenuous physical activity. But mostly people with conditions like hypertrophic cardiomyopathy or some syndromes which predispose you to sudden death, they are not aware of their cardiac disease. Even investigations like echo can be normal. So people who are unaware of their cardiac disease, indulging in strenuous activity, physical activity, may suffer or are more likely to suffer from cardiac arrest during strenuous physical activity.
And therefore, what would your advice be to people, and at what age does one have to start being careful? Because, many people go to the gym. We're hearing of so many cases of people collapsing in the gym. So what would your advice be?
Right. So if you are a smoker, you are predisposed to cardiac arrest, death at any time, even at the age of 20 years. So if you are a diabetic, then every year you have to go for a cardiac checkup. And anybody who is more than 40 years should have regular cardiac checkup. If you are starting a gym, joining a gym, before joining a gym, you should get yourself checked up for cardiac disease. If you have family history of sudden death, in your family people have suffered sudden death, then you should get yourself thoroughly investigated before indulging in physical activity like ECG, echo, and a cardiac consultation. So people who have family history of sudden death or have a risk factor for heart disease have to get themselves checked up before indulging in physical activity. One more advice. I see many young people joining gyms and taking supplements, the contents of which supplements we are not aware of or they are not aware of. Those supplements are sometimes the cause of cardiac problems during physical activity.
All right, so all these are very important issues to keep in mind. And so, Dr. Jha, clearly it's very important that if you have somebody with cardiac or heart disease in the family, you must know CPR. Even, I suppose, people in gyms should learn CPR. If you could tell us, what is the first thing you should do if someone goes into cardiac arrest?
Yeah, if we see that suddenly someone is collapsing and collapsed immediately, and first thing we should do that we should check the pulse if you know, or if the patient is unresponsive to the painful stimuli, like if you will pinch that patient and if he is not moving his limbs or if he is not responding, then immediately first thing that we will have to do CPR. CPR means it's a simple chest compression. So recently we have seen one video in the foreign USA that one patient suddenly he fell down and his little toddler son, he started jumping on his heart and then he saved his life. So it's a simple, that's a chest compression and that should be done immediately. And it will be always better if you will call some bystander and two person can do in a better way. It will just like a 100 chest compression in a minute till the patient is responsive. Or the second person should immediately call the emergency department, because anyway if the patient is responding to the CPR, then also he must go to the nearest hospital, and if he is not responding till then until the emergency comes, the person or the bystander, they must continue the CPR, because we have seen there is a benefit of CPR and the many people we can save after doing this CPR.
All right, so it shows how important it is for people to know CPR to respond and not just be bystanders. Dr. Jha, what is the first thing you should do? And also, Dr. Rai, if I can come to you on that, lack of CPR awareness is a big health challenge in India. And tell our viewers about, what are the main steps of CPR?
Right. So cardiopulmonary resuscitation or CPR, the acronym can be CAB. CAB, compression, airway, and breathing. So one should be doing compressions by using one's hand over hand. This should be put on the lower part of the central chest bone or sternum in a normal adult. And in a pregnant lady or adolescent, you can compress the center of the chest bone or sternum. The compressions should be sufficient to depress the chest by 2.5 inches. The rate of compression should be 100 compressions per minute. And after every 30 such compressions, you have to give 2 mouth-to-mouth or mask-to-mouth breathing. So that is compressions. Second is you have to take care of airway. So you have to do a head tilt, a chin lift, and a jaw thrust. You have to tilt the head backwards. You have to lift the chin and you have to open the mouth. You have to check for any secretions or any blockages in the cavity, in the mouth cavity. If you see some secretions or some blockages, something lying there, you have to clean it with the hanky or gauze piece. Third is breathing. So for every 30 compressions, you have to give 2 mouth to mouth or mouth to mask breathe. So 30 compressions, 2 breathing. After this comprises 1 cycle. So after every 5 such cycles, we have to check for the pulse, return of pulse, by seeing the carotid pulse or the radial pulse. If the pulse has returned, you should plan to shift the person to a hospital. And the first thing when you observe such thing happening is calling for help. So even before you are starting this chest compression, airway clearance and breathing, you must have called for help. And if the help has arrived, shift the patient to the ambulance, get the ECG, and the rest will be taken care of by medical personnel. So compression, airway and breathing, and calling for help, right? So that is those are the important components of CPR: compression, airway and breathing.
All right, all this is very important for people to know, and there needs to be more awareness around this in the country, given the incidences of sudden cardiac arrest that we're seeing. We'll slip into a short break. We have a lot more questions for our doctors. Do stay with us. Welcome back to our special show. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. But let's go back to the doctors to ask questions around this issue. And Dr. Hazra, how common is sudden cardiac arrest in India and can it be prevented?
To large extent, it can be prevented. It can be predicted to large extent. If you people go for a regular medical checkup, now we have a genetic testing, imaging, even to the molecular level we can go. Even we can go for autopsy study of the patient who has died, and that will prevent sudden cardiac death.
All right. Dr. Jha, if you could tell us, what lifestyle then should one follow to prevent sudden cardiac arrest?
Yeah, obviously there is a very important importance of the lifestyle in one's life, and we have seen recently so many young actors and they have died suddenly because of the sudden cardiac arrest, and all because of the stress. So one of the most common cause of the sudden cardiac arrest in the younger population is the stressful life, because as per the WHO recommendation, there is a very importance of the sleep. So if someone is having sleep of 7 to 8 hours, that is sufficient, and that is very important. The second, the work style. So the brisk walk, that is the walk in between the walking and the running. It should be in between that, and it should be at least 150 minutes per week, and that can be divided into 5 days or 4 days in a week, because the people are very busy today, so that is not possible to do every day brisk walk. So that can be divided into 4 to 5 days, and that must be followed by everyone. Then WHO recommends that at least 5 types of fruit or vegetable should be added in our food every day. So that depends upon the locality, because in India different people are having different food style, so that can be done as per. Then early detection of the diabetes, hypertension, dyslipidemia, that is very important. And after the age of 40, I would recommend that everybody must go for lab investigation as well as for one-time cardiac checkup. Then if someone is diagnosed as a hypertensive or diabetic, so many people are having fear that if someone will start medication, then they will have to continue. So one must, it is very important that if someone is advised by their physician for antihypertensive, that is medication for blood pressure, sugar, they must start it, and they must do regular checkup with their concerned doctor. Then the junk food. So one must avoid junk food, because junk food contains so many things, and generally junk food and the roadside food that is made in the palm oil, and that is very bad for our heart and for our cholesterol. Then one more thing I would like to add, that the people are doing their exercise, so that should not be done in the odd hour, like at 10 o'clock, 7 o'clock, 9 o'clock, they are doing rigorous gym. And with that gym, as Dr. Rai had said, that they are taking some supplement. So we don't know what is it. And generally we have seen that the people who are taking the supplement with odd hour gym, they suffer from the sudden cardiac arrest and they must have some coronary artery disease. Quit smoking, that is very important, because smoking is a very dangerous. And in my study I have seen in the Safdarjung hospital that the 70% people, young people who had a heart attack, they were smoker. So these are the things we will have to follow, and then we can prevent the sudden cardiac arrest and the coronary artery disease.
All right, so important to keep all these issues in mind. You spoke about diet and junk food. Dr. Rai, is there a link between dietary cholesterol and heart disease?
Right. So dyslipidemia, or an inappropriately high amount of bad cholesterol, is statistically one of the most significant risk factors for coronary artery disease or blockages in the coronary artery. And the amount of cholesterol in your blood is dependent upon your genes, but is also significantly dependent upon the amount of cholesterol intake in your diet. So you should take limited amount of LDL cholesterol or bad cholesterol or triglycerides, and you should take good amount of good cholesterol, that is HDL cholesterol. HDL cholesterol is protective, and we can get HDL or good cholesterol from fresh fruits, fresh green vegetables, things like almond and walnuts, and physical activity is also a factor which increases the amount of good cholesterol. So dietary cholesterol is definitely statistically one of the most significant risk factors for heart disease, coronary artery disease.
All right, Dr. Hazra, if you could tell us, is there a relationship between heart disease and diabetes?
Very strong relationship between diabetes and heart disease. The incidence of sudden cardiac death, coronary artery disease, heart failure, any form of stroke, peripheral vascular disease, kidney disease is very high in patients who are having diabetes, not treated with modern medicines. Like there are certain modern medicines like GLP-1, SGLT2 inhibitors. So these are the two medicines. If people are not taking, there is a high chance of death due to diabetes. To large extent, it can be prevented. So there is a strong linkage between onset of diabetes, duration of diabetes, and other risk factors in that particular person, especially the smoking, lack of exercise, stress, lack of sleep. LDL level more than 30 milligrams. 30 milligram or zero LDL is the ideal concept. And people who are living in a polluted cities and having a family history or genetic preponderance of having heart disease, if you add 1 plus 1, it's not always 2, it becomes 4. So diabetes plus your ischemic heart disease come together, and most probably they originate from the same soil, and they ultimately culminate into cardiac death.
Right, Dr. Jha, when experiencing a heart attack or heart attack symptoms, should one take any medication?
Yeah, actually, if someone is having heart attack, and if he is having sudden heart attack, means what? Sudden onset of any type of chest pain, and the chest pain above the umbilicus and below the earlobe. So any type of chest pain can be heart attack, and sudden onset of breathing difficulty. That means the patient was all right and suddenly he had some breathing difficulty. He is not feeling with the sweating. So these are the symptoms of the heart attack. And if someone is having, literally speaking, immediately they should visit to the nearest doctor or the nearest hospital, because immediately if someone will take some sublingual sorbitrate tablet, so that can reduce your blood pressure, and you exactly don't know the status of your blood pressure, and that can harm the patient. So ideally speaking, they should immediately rush to the nearest hospital. But if they are in the remote area and if they are having aspirin, they can take the aspirin tablet immediately. And if their blood pressure is good, then for the relief of the chest pain, they can take sorbitrate tablet, that is the sublingual, and that can be taken 5 milligram immediately. But I will again advise that without taking any advice from the health expert, one should not take any type of medication, because that can also harm him. So the main thing is they should immediately rush to the nearest hospital.
All right, Dr. Rai, what types of food should one eat to avoid or better manage cardiovascular disease?
Right. So fresh fruits, fresh seasonal fruits, which is available locally, fresh green vegetables. So 4 to 5 servings of fresh green vegetables, 4 to 5 servings of fresh fruits, at least 60 grams of almond and walnuts kind of dry fruits, and avoidance of saturated fat, food which is rich in saturated fat like mutton and chicken and eggs, and physical activity. So you can, if the kind of oil that you should use can be groundnut oil, can be mustard oil, and unrefined mustard oil nowadays in India is considered to be one of the best sources. Also, even coconut oil is permitted. Now, even what we call desi ghee, a little bit of desi ghee, 1 teaspoonful a day is not a bad idea. But deep fried food should be avoided. Preserved food like pickles and packaged food should be avoided.
All right, Dr. Hazra, how would a person know if he or she is doing, the CPR with the correct technique, and what results from CPR should they expect and at what time?
Right. The CPR is very basic thing to save a life. It is done by a doctor, done by non-medicos. It can be done by anybody and everybody. And you start learning the CPR technique from the school, then the college. Any time of your life, the CPR should be learned. It can be practiced in the hospital, outside the hospital, in a salon, in an airport, in a studio, in a cinema hall. And if somebody is found unconscious, immediately check the pulse and start giving proper CPR if you have some knowledge. Even if you do not have knowledge, chest compression is the ideal one, and the breathing is the next attention. So try to compress the chest as much as possible. If it is a children, then maybe a thumb pressure. But if it is adult, usually the dominant hand should be on the front part of the chest. If you know that the heart belongs to the left side in 99% of the people, and very rarely it is on the right side of the human chest. So any compressions of the chest which can propel the blood, the heart to the brain, can give some time for the medicos to take these patients to the nearest hospital. So how do you know that you are effectively doing CPR? If you have a learning, then 50:2 or 30:1. These are the basic, for the medicos, there are ACE protocol we follow, like you give, if you have 2 people, one will take care of the breathing, other will try to compress the chest. If you have 1%, then you try to compress the chest because you have a sufficient oxygen in your blood, which can take care of the brain. So you have to push this blood from the heart to the brain and other organs. So brain, once it is dead, it becomes vegetative. Now the certain signs, if the patient wakes up immediately, you can stop CPR. You can check whether the chest is going down with each compression or not. There may be some fractures of the rib. Actually, that is actually tells us that you are actually producing heart compression. So don't get stopped by having a sound of fracture of the ribs, and you can feel the fracture on the ribs. That actually may help some people life getting back into a normalcy without losing their breath. So there are telltale signs of effective CPR. If you have a medico, we have a different signs and symptoms. But if you're a non-medico, if you're practicing outside the hospital, put these patients on a flat surface, compress the chest, palpate the pulse, try to speak to him, try to hear the breath, or just you put your ear to the nose so that he's breathing. If the breathing comes or the heartbeat comes, you can stop. You can call SOS, you can call emergency. So there are many steps, but basic thing is the compression, mechanical compression.
All right. Well, thank you so much, doctors, for patiently answering all those questions and helping to create awareness around this very, very important issue. Thank you all for watching at home. Goodbye.